Hi, all of you. A very good morning to you all. So I thought I'll make a quick video and plan for revision for next week. So many students have got this doubt. How are you going to plan your revision for this coming week? And accordingly, we are going to modify this in the upcoming week. So it's very important video. Please watch it. Okay. So this is majorly for our academy students, and I want you to allot 2 hours. You all know this. Okay, 2 hours for the revision. Okay. Now others who are listening this on YouTube, this is going to benefit you as well, because this is going to be a generalized plan. Okay, where we're going to apply the concept of revision of 2 hours every day. Okay, plus 8 hours of learning of whatever subjects you're weak in. That should continue. That's very important. Okay, now yes, and please note, this is going to change in the coming weeks. More and more time will be allotted to revision, and I'll be updating more videos on that, okay, as we go on. But now this is for the coming week, and this is going to be modified, so it's very important video to watch. Okay, so now basically I'm going to first discuss what are the subjects we covered so far in our review. Okay, not revision. Revision is just 2 hours. So in our review, we covered how many subjects. Now time we are going to allot for revision, then the plan. Okay, so now as you all know, those who are there in our academy, 5 subjects have been reviewed. 5 very difficult subjects have been reviewed. Okay, based on the poll which was done among you, which is the most difficult six subjects. So one more is there. Community is going to be starting today. But yeah, this was the 5 subjects, the most difficult subjects we reviewed in the last few weeks. Okay, that is 1 week per subject we gave and we reviewed it. Okay, you know it. So these are subjects: pharmacology, oral pathology, medicine, general medicine, prosto and anatomy. So these are the 5 subjects we covered. Now we are going to plan our revision for these 5 subjects, okay, for the coming week. Okay, earlier it was very easy that we did pharmacology, then we were revising pharmacology, then we did oral pathology also, then we combined them. So now it's 5 subjects. How are you going to plan your 5 subjects revision in 2 hours? So now how much time you're going to allot for revision? So it's very important that you allowed at least 2 hours for revision and not more than 2 hours for revision at this stage if you are not confident in all your subjects. Okay, now if you're someone who have done like our batch 1, batch 2 and even batch 3 students, for you all it's a kind of revision throughout going since 2 months now, isn't it? So, but yeah, definitely I know that you'll tell me that no sir, at that time we were not very seriously enjoying when the exam date, we were not seriously studying. So when the exam, we were actually enjoying, and yeah, when the exam date came, then only we started proper learning. So yeah, that's fine. But yes, you have done something, isn't it? So you're allotting 2 hours, and that is 30-minute session each. That is 4 sessions. I'll come to that, how you're going to allot them. But now let's come to the plan, how your plan is going to be. So you have to select 4 subjects among these 5. Then only this 4 will come into action. Okay, 4 sessions. So you're going to select 4 subjects. Okay, wait, I know you have lots of doubts now. You're going to select 4 subjects among these 5. Okay, of which you have to know that anatomy is mandatory. Why? Because anatomy was the last done subject. So you have just finished your anatomy yesterday exam. Okay, so you have to be knowing that anatomy has to be continued with your revision. Before that we did prosto. So maybe these are the 2 subjects you feel a little bit weak about, because we have been revising the other 3. But anyway, anatomy is mandatory. You have to definitely include among the 4 subjects selected, 1 should be anatomy. Okay, now how much subject you're going to cover each day? Not 4. Though you're selecting 4, you're going to cover 2 subjects each day. Now we have those who are there in Dental Maze Academy, you know this, we have been doing this, but now 1 more subject is added. That's why I'm putting this video. Okay, now 2 subjects each day, of which of the 4 selected subjects. Now, what is the next? So we know that 1 subject is anatomy. So that is 130 minutes will definitely go to anatomy. Okay, now we have to select 2 subjects. I'm sorry. 3 subjects among the other 4. Anatomy is, I'll just remove it from here. Okay, we have these 4 subjects Okay, pharmac, oral pathology, medicine, general medicine. So among these four, you're going to select three subjects. I'm going to give you an example of three subjects now: pharmacology, oral pathology, and medicine, and general medicine. For me, just for an example. Okay, or if you are not comfortable with prosto, you can select prosto and remove some of you are well and good with pharmacology. So it's okay that you even omit pharmacology, do prosto. But please note, pharmacology, one classification review every day is very important, 5 minutes. Okay, so we have been doing this continuously now. So I'm hoping that you have gained that speed of doing a classification, one classification a day, 5 minutes. So that speed has been gained, that has to be continued. But 30 minutes, that's your choice. You're going to select three subjects among these four. Okay, so the third step is also over. Okay, now what next? Now the plan is going to come. The first plan we said, anatomy is mandatory every day. Yes, anatomy is mandatory every day. 30 minutes anatomy, no compromise on that. Okay, now don't worry, you'll say only 30 minutes for anatomy. No, we're going to bring it to 1 hour very soon. I'll tell you how. Now, previous day's topic review is mandatory every day. That's what we have been doing from day 1 of our courses. I would say rather in the last year, November, when we started our first batch, we did this. Previous day's topic review every day. So this will be consuming the next 30 minutes. So for example, today you're doing epidemiology today. Tomorrow you have to review epidemiology, a quick 30 minutes review. Okay, so that you tell your brain that please don't delete that file which you have done yesterday. That's only the purpose. Okay, it's not learning them, it's not by hearting them. Okay, so your major learning should come by today for epidemiology. Anyway, let's continue. So that is what you have done. Anatomy is mandatory every day. Previous day's topic is mandatory every day. So these two. Now what you have left with is 30 minutes, 30 minutes. Okay, that means 1 hour you have been left with. So what you're going to do there? 2 subjects. Now you have how many? Total how many? 4. Of which one is anatomy. But still, you're going to select 2 subjects for day 1 and 2 subjects for day 2. This is going to be alternated. Day 1, day 2, day 1, day 2, day 1, day 2, like that. Okay, for 6 days for the coming week. Okay, so I'm going to select 2 subjects, which is pharmacology, oral pathology. Among the 3 here, pharmacology, oral pathology selected. What is left? General medicine. So next day, I'm going to do general medicine and do anatomy again. Means to say, every day you are doing anatomy, okay, 1. And every second day you are again doing anatomy. Okay, means to say that it's like, every second day you're getting 1 hour of anatomy. Okay, and the first day, half an hour of anatomy. So you're doing anatomy every day. Every second day, you're going to do 1 hour of anatomy. Okay, means to say, just give you a plan. Day 1, okay, anatomy, previous day's topic, you're going to do your pharmac, okay, and you're going to do on your today, for example, pharmac and oral pathology. So that's the today. Tomorrow, you're going to take the next subject, which is general medicine, okay, general medicine, and then anatomy again. So this is how your plan is going to be. Then again, the same will continue. Pharmac and oral pathology, like that. So this is going to be alternating for you. Okay, so means to say anatomy again, that is day 2 anatomy is done for 1 hour. Okay, so that's going to be planned. Now those who have not done these subjects, but you have expected or you're expected to do at least 5 subjects by now, or at least 4 subjects by now, which becomes easy for you, but then you have to gain your speed. Now, okay, in our academy, you know that these are the most difficult, along with anatomy, these are the most difficult, and one more community is going to come. So we have, that means to say that we have done the most difficult areas, most compromising areas by most of the students in entrance preparation. So that is what we have covered so far. Now the rest of it, as I've told you, it's going to be a faster, in a much faster way, because for most of you, for most of the batches, all the other subjects are covered in detail. Okay, so anyway, but don't worry, don't panic, don't say no, for me it is not done. Don't worry, we'll have a solution for that. Okay, we will find out a solution, and anyone having any problem, any issues, do discuss. Okay, we'll find a solution for anything. if it's not covered for you, and especially for the crash course students. Okay, those who are there in the crash course batch, you might say that no, I've just very recently joined. What will I do? Don't worry. Okay, these 6 subjects, if you're doing it properly, you have done your half of your job, 6 subjects. Then the rest of the 14 subject is what is remaining, which is we'll handle it. Okay, so thank you so much. Have a great day ahead and take care.